Hi everyone, I'm Dr. Karishma Kagodu, plastic surgeon from Bangalore. Today we will discuss about a procedure called as the breast fat grafting or a breast fat transfer. This procedure is done for women who are not looking for breast augmentation with implants. In a fat transfer, we take fat from one area on the body and we inject it into another area in your body. So a fat transfer can be done for areas for the hand for rejuvenation. It can be done on the face, but today we're going to talk about the breast fat transfer. So the common areas from where the fat is taken, it could be from the abdomen, from the love handle area, from the inner thighs or outer thighs, even from the inner knees. Now there are many women who are looking for just a mild to moderate enhancement of the breast size and volume, and they are not looking for the implants. In that case, fat grafting is the most simplest procedure. It has a very less downtime. We do the procedure by starting with a liposuction. Now, liposuction, as you all know, is removing fat from an area in the body. During the fat transfer procedure, the instrumentation that we use, the cannulas that we use are much different from the regular liposuction. These cannulas are much finer, and we use the fat, we process it once it is taken out from the body, and we immediately transfer it into the breast region by making extremely tiny cuts of 1 to 2 millimeters. So there are absolutely no scars on the breast or almost invisible scars, and the area from where we do the liposuction also has just keyhole cuts. The breast transfer procedure is usually a daycare procedure. The women come in the morning of the procedure and you can go home the same day in the evening. The pre-procedure markings are done. We also decide where the fat has to be taken from. The fat which is chosen is usually from those areas which is really stubborn, and the women realize that they are not losing fat in the areas. When we take fat from those areas and transfer it to the breast, we realize that the fat lasts for a longer period of time. This procedure is restricted for those women who just want a very mild to moderate breast enlargement. So once we take out the fat from the various areas, we have to process it, sometimes put it into a centrifuge. Most times manually the fat is removed, unlike the other cases in liposuction where we use the Vaser. Here I use a manual liposuction. We use 10 or 20 cc syringes and remove the fat with fine cannulas. Then we allow the fat to stand for a while, separate the blood components from the pure fat. This pure fat has the stem cells in it. We do not want to destroy these stem cells which are in the fat. So the pure fat along with the stem cells is then transferred into the breast, making very tiny cuts. These cuts are almost invisible. A tiny dressing is placed over the breast, and in the liposuction areas there is a pressure dressing which is done. So the areas where we've taken out lipo from, you will have to wear a compression garment for 2 to 3 weeks. For the breast, you will just have to wear a supportive garment. The recovery of a breast fat transfer is quite simple. Usually it is about 7 to 10 days of swelling or a little redness and bruising over the breast skin region, after which the breast starts to settle down. In a breast transfer, there is one disadvantage, that you may lose a percentage of fat that we have transferred. So say we have transferred about 200 to 300 ml of fat into the breast, you may lose about 30 to 40% of the volume, and this is normal with all the patients. So in a fat transfer, if you are looking for a bigger augmentation, we suggest that you do about 2 to 3 stages of the fat transfer, about 3 to 6 months apart. In many women, we notice that most of the fat that we have transfers does stay back in the breast and does not get absorbed by the body. But for those who have lost a little more fat than another, we may have to do a second or a third stage of the transfer. If you want to know more, subscribe to our YouTube channel, Dr. Karishma Aesthetics, and make sure you hit that bell icon in order to get all the latest updates and videos.